Today, we're going to pull back the curtain on a profession we all feel like we know pretty well, nursing. We're going to look at all the incredible hats a modern nurse wears, because trust me, it's so much more than what we see at first glance. Let's get into it.
Just for a second, what's that image that pops into your head? For most people, it's probably someone in scrubs, maybe a stethoscope around their neck, checking on a patient. And you know what? We probably all have a very similar picture in mind.
And that makes perfect sense. The most visible, and you could argue the most fundamental part of a nurse's job is being that direct caregiver. It's the face of nursing we see in hospitals and clinics. It's really the foundation of the whole profession.
And look at the words used here. A caregiver isn't just someone who does things, they're a nurturer. This role is called both traditional and essential. That tells you this is the absolute heart of what it means to be a nurse.
So what does being a caregiver actually involve? Well, of course, it's the hands-on stuff, but it's also about making a patient comfortable, being a supportive presence, and, this is key, having some serious clinical skills. Everything else we're about to talk about, it's all built on this foundation. Right. So what if that image, that caregiver role, is just one single piece of a way bigger, more complicated picture? What if the nurse at the bedside is juggling 5 or 6 other jobs right in front of you, and you just don't see them? Well, that's exactly what we're going to unpack.
Okay, so let's start with a set of roles that puts the nurse right by the patient's side, not just as a caregiver, but as a true partner. This is all about empowering the patient inside that often confusing healthcare system.
First up is the advocate. Think of the nurse as a protector. They're the one who helps you make sense of it all, who makes sure your voice gets heard, and who backs up the choices you make about your own health. They're basically your champion in the system. This is such a perfect example of what advocacy looks like in the real world. A doctor might throw a bunch of complex medical jargon at you. The nurse, as an advocate, steps in and translates it. They break it down into plain English so you can actually understand what's going on and make a decision that's right for you.
And that flows right into the next role, the educator. We're not just talking about being handed a brochure on your way out the door. A nurse as an educator is like a counselor. They interpret all that complicated info and give you the tools you need to take care of yourself.
And this is super practical stuff. It's everything from explaining how to take a new medicine, to talking about healthier habits, to really helping you understand why it's so important to stick with your treatment plan for the long haul.
Now, holding all of this together is the role of the communicator. And notice it says professional skilled. This isn't just about being a friendly person to chat with. It's about a trained ability to listen, to really hear what a patient is saying, and to build a relationship that's genuinely helpful and therapeutic.
And finally, in this group, we have the nurse as a consultant. In this role, they help you see all your options. They don't tell you what to do. Instead, they lay out the choices and help you find a sense of control over your own health. It's incredibly empowering.
Okay, now we're going to zoom out. We're moving from the one-on-one relationship with the patient to look at how nurses actually shape the entire system they work in. They're not just gears in the machine, they're the architects. This is such a critical point. Nurses aren't just following orders. They are on the front lines, actively building, managing, and improving the very systems that deliver healthcare every single day. And that leads us to the change agent. A nurse sees a workflow that's broken, or maybe even unsafe. As a change agent, they don't just sigh and accept it, they become a problem solver, using their communication and coaching skills to make real, positive changes happen. Now, this is a really interesting one. Nurses often have to be both a leader and a manager, sometimes in the very same hour. As a leader, they're mentoring staff and fostering teamwork. But as a manager, they're making the tough decisions, assigning resources, and evaluating how things are going. You absolutely need both for a hospital or clinic to run smoothly. All right, for our last section, let's look at the roles that push the whole profession of nursing into the future. This is where nurses become the innovators and experts who actually advance the science of healthcare.
That's right. Nurses are researchers. They aren't just applying the rules. They're often the ones writing them. They are methodical investigators who use data to figure out the best way to solve really tough health problems, like preventing infections or managing pain.
And this is a serious scientific process. It's not just guesswork. You can see the steps here. They collect and analyze the data. They come up with possible solutions and test them out. They pick the best one, and then they start all over again to keep improving. It's the scientific method right there on the hospital floor. And then, at the very top of the profession, you have the nurse as an expert. These are the clinicians who aren't just practicing nursing, they are defining it for everyone else. They're developing new theories, writing books, and teaching the next generation of nurses.
And the impact these experts have is just huge. They're doing their research, teaching in universities, writing the textbooks. They even end up in courtrooms providing expert testimony. They shape healthcare policy, education, and the quality of care that we all receive.
So, we've looked at all these different pieces: the caregiver, the partner, the architect, the innovator. How does it all fit together? What's the complete picture of a modern nurse? I think this shows it perfectly. That caregiver role is absolutely essential, but it's just one slice of the pie. A nurse, today, is all of these things at once. They're a partner to their patient, an architect of the system, and an expert pushing the field forward, all wrapped up in one person.
So I'll leave you with this question. Now that you know all this, the next time you meet a nurse, look a little closer. Of course, you'll see the caregiver, but maybe now you'll also spot the advocate, the teacher, the leader, and the scientist, all working together. Thanks for watching.